Thank you, Commissioner and Governor. Good afternoon, everyone. I'm going to add into this the update on our data. In terms of our numbers for today, we have 53 new cases of COVID-19. There are currently 78 people with COVID-19 hospitalized in Rhode Island, and 8 people are in an ICU, with 4 of those 8 people on a ventilator in an intensive care unit. Sadly, as the governor mentioned, we do have one additional COVID-19 fatality to report. This individual was in their 90s. Our sympathies continue to be with the families of this cherished Rhode Islander, as well as all those impacted during this time. I want to take a moment to add to what's been shared and talk about COVID-19 and children. Something that we've been seeing both across the country and in Rhode Island is that COVID-19 is generally a much milder illness for children compared to adults. Hospitalization rates for children are significantly lower than hospitalization rates in adults with COVID-19 here in Rhode Island, as well as in general, nationally. Of all our hospitalizations, 1% of them have been seen in the infant to age 9 years category, and 1% have been among people aged 10 years to 19 years old. There's a lot of research being done right now to better understand the rates at which people of different ages get COVID-19 and are transmitting COVID-19. However, our experience with children in structured environments in Rhode Island is that we have seen very little secondary spread. What do I mean by a structured environment? This is referring to an organized setting and what we are talking about as the goal for K through 12, similar to how we applied it for childcare. An organized setting includes a place where screening for symptoms happens frequently, where regular environmental cleaning is done, where there are clear rules that are followed about mask wearing, and where people are ensuring social distancing. For example, we've seen fewer than 5 cases associated with summer camps through this whole summer, and all of those cases were isolated without secondary transmission continuing. That means in none of these instances did we see spread between children. That's a huge kudos to the tremendous work that our summer camps have done, and it again reflects when you apply the structure and the planning that we are taking step by step in each of these scenarios in Rhode Island, you can see the benefits of those outcomes and how we can keep children and staff safe. As I've discussed previously, we are also not seeing much secondary transmission at child care sites. More than 700 child care sites are currently operating in Rhode Island, each with their own COVID-19 prevention and control plan. We've seen roughly 45 cases of COVID-19 among children and adults associated with these hundreds of sites. And these cases were spread out among approximately just 25 facilities out of the 700 plus child care sites that have been open. When you think about those numbers, 45 cases among 25 facilities, it's clear that we're not seeing large groupings of cases at individual sites. And again, the key component is not seeing ongoing spread, secondary transmission of cases. When we're able to keep that under control, that's where we see the success of keeping COVID-19 controlled. What we're focused on is preventing spread in schools. We know that cases will occur, similar to how the flu has occurred or other respiratory illnesses. COVID-19 can occur. What our key is stopping transmission to multiple other people. Our experience with child care makes clear that when a facility takes a thoughtful, comprehensive approach to prevention, which is a part of the COVID control prevention plan, the chances of us seeing new cases at that site are greatly minimized. So we have the tools in place to be able to keep control of COVID-19 when isolated cases occur. We absolutely have the infrastructure in place. We are going to absolutely replicate this infrastructure in schools and limit or prevent the spread of COVID-19, which is our goal, so that people can have a productive academic school year.